Welcome to a special legislative episode of FMA-TV, your source for FMA news and information. I'm your host, Vanessa, Associate Director of Membership Development for the Florida Medical Association. Today we're going to talk about the FMA's #1 legislative priority for this year's session of the Florida Legislature, which actually kicked off with the Governor's State of State address on Tuesday, March 8th. The FMA has made passage of meaningful medical liability reform the top priority this year and is pushing legislation House Bill 479, which will bring more balance and fairness to the litigation system in Florida. Here to tell us more about HB 479 is the FMA's General Counsel, Jeff Scott. Jeff, please tell our viewers about HB 479 and how it's going to improve the medical liability climate in Florida.
Absolutely. House Bill 479 is one of the most significant pieces of medical liability reform legislation in Florida in many years. If passed, it will significantly improve our tort system and make Florida a much more attractive place to practice medicine. The bill has many components, and I'd like to highlight a few. Right now, there is no accountability when an out-of-state hired gun comes here to testify against one of our doctors in a malpractice suit. This bill would provide that accountability by making out-of-state witnesses get a certificate from the Florida Department of Health. Under current law, a physician defending against a malpractice lawsuit can't talk to any of the other doctors who treated the patient, but the patient can talk to all of the other doctors. Now, this is patently unfair. This bill levels the playing field and gives the doctor and the patient the same access. We all know that defensive medicine is driving up the cost of health care. Physicians must choose between ordering a test or facing a lawsuit for negligence. Right now, if the test isn't ordered, all that the plaintiff has to prove is that the failure to order that test, more likely than not, was negligent. This bill will make the plaintiff prove by clear and convincing evidence that not ordering the test breached the standard of care. This gives the doctor the freedom to order only tests that are necessary. And finally, the bill will empower physicians who have been sued. A judgment or settlement can have a major effect on a doctor's career. It's reportable to the National Practitioners Data Bank, and it could affect managed care contracts and medical staff privileges. Right now, a doctor has no voice at all in settlement terminations. This bill changes that and puts the doctor in control of settlement decisions.
Wow, that is a pretty comprehensive piece of legislation. What are the chances of this getting through the legislature?
Good question, Vanessa. The FMA is working hard to get this important piece of liability reform passed this year. The bill's sponsors, Representative Mike Horner in the House and Senator Alan Hayes in the Senate, are working hard too. It would be a tremendous help if physicians throughout the state would call their hometown legislators and tell them that medical liability reform is important because it will increase access to care in our state and reduce the cost of health care.
Thanks, Jeff, for telling us about HB 479, and actually thank you for joining us as well.
Thank you, Vanessa.
It's very true that Florida is facing a real access to care crisis due in large part to out-of-control litigation. And here to tell us about this problem is the president of the Florida Medical Association, Dr. Madelyn Butler. Hi, Dr. Butler. Thank you for joining us today.
Thank you, Vanessa. It's so glad to be here with you.
Dr. Butler, can you tell our viewers a little bit about the physician workforce shortage in Florida?
Physicians continue to leave Florida because of the litigious environment. Those that stay are abandoning the high-risk, high-need specialties. We can't compete with states like Texas, which have passed liability reform when it comes to recruiting new physicians to Florida. The frightening fact is that Florida faces the third largest physician shortage in the nation. We will need 63% more primary care physicians within 10 years to avoid a significant access to care crisis. We also have significant shortages of physicians in family medicine, internal medicine, pediatrics, OBGYN, general surgery, emergency medicine, and neurosurgery. The data also tells us the physicians we do have are retiring faster than they are being replaced. In the next 5 years, 13% of Florida physicians indicate that they plan to retire, and 5% plan to move to work in other states. Our workforce is also aging. Over 35% of Florida physicians are over the age of 56. All of this causes Florida to be designated an access to care hotspot by the American Medical Association.
Those are some very alarming statistics about the access crisis that we're facing here in Florida. Why is Florida losing in the battle with other states to retain and recruit physicians?
Simply put, litigation is driving physicians out of the state and discouraging new physicians from moving here. Florida medical liability premiums are the highest in the nation by a wide margin. For some, including OBGYN surgeons and internal medicine physicians, even the lowest liability premiums in Florida are still higher than the highest premiums in most other states.
Dr. Butler, like you said, Texas actually passed medical liability reform. What has happened in Texas since they actually passed that?
Since then, Texas has gained more than 21,000 new physicians, a 37% increase.
So is it fair to say that the Texas experience tells us that medical liability reform works?
Absolutely, and I intend to work shoulder to shoulder with physicians throughout the state to deliver that message directly to the lawmakers. The FMA has a great team that is working hard on behalf of physicians every day. This is why our association exists, to help physicians practice medicine.
Thank you, Dr. Butler, so much for speaking with us today about the access to care crisis and about medical liability reform.
Thank you so much, Vanessa.
To learn more about how you can get involved, go to doctorsfortortreform.com or the FMA website, flmedical.org. We will be providing important updates on the medical liability reform legislation throughout the coming weeks, so stay tuned. That concludes another episode of FMA TV. Thank you for tuning in, and we'll see you real soon.